All right, I think we can go ahead and get started. All right, thank you so much everyone for joining us tonight for this webinar. I'm really excited for it. So tonight we are going to meet the community fighting for families. Next slide. So for today, we'll do a quick introduction from Resolve. We'll jump into why collaboration, strength, and impact. And then I really want to spend a lot of time with our partner spotlights on our partner organizations that we work with throughout the year on different states, strengthening or expanding or just getting coverage. And then we'll switch it over to a discussion where they can share some of the challenges that they've seen this past year or in this coming year, and just different ways that you all on this panel, in this webinar, can get involved and can advocate. And then we'll just finish off with any questions that any of you might have before we do closing remarks and any calls to action. All right, so a quick welcome from Resolve. So we are Resolve, the National Infertility and Family Building Association. So we have a name change. We were established in 1974, so Resolve has been around for a long time, a little over 50 years now. Resolve exists to empower people navigating their fertility journey through trusted information, community support, and grassroots advocacy that can make family building options accessible to everyone. So we're really trying to provide a number of things, including access to care, advocacy for coverage, access to support and community, access to education, and just general awareness of all family building options for everyone. Next. So the whole purpose of this webinar, which I'm really excited about, is to showcase how collaboration really strengthens impact. As of 2026, I'm so happy to say that we have 25 states that do offer infertility coverage laws. 15 of those states have some sort of IVF mandate to cover. 21 states have fertility preservation mandates to cover. So there's a lot of different states that, especially in the few coming years, the past couple of years, that have either expanded or actually introduced coverage for fertility coverage or fertility preservation coverage. And none of this would be possible without the collaborative work of all of our partner organizations. I know Resolve is amazing, but we're not just working alone. Every state that we go into, there are several other coalitions, groups, partners on the ground that make it possible for us to be able to provide coverage for people in those states. And so the purpose of this webinar is to just showcase some of those partner organizations that we do work with so you can see what exactly they do, but also just get some insight on their work as well in the coming years. So with that, I would love to introduce Dana Bacon from Blood Cancer United. Next slide.
Hey folks, I'm Dana Bacon. I work as Senior Director of State Government Affairs for Blood Cancer United, which until recently was called the Leukemia and Lymphoma Society. So, as you can imagine, our work is to help support blood cancer patients. Our priorities include finding better cures, treatments for these patients, and helping improve their quality of life. And that goes to key aspects of survivorship. Like the slide says, we are seeing more people survive a blood cancer diagnosis than ever. But with that survival comes, what do you get to do with the rest of your life? If you are a child or a young adult who gets a blood cancer diagnosis, the treatment that hopefully will save your life may also render you infertile or close enough that trying to have a child of your own after this diagnosis and treatment is extremely hard. So we've recognized that making advances in coverage for not just fertility preservation, but fertility treatment's really important. It's great to be able to preserve your family building options literally after diagnosis and treatment, and then when the time comes to take that next step to go from preservation to actually having that child, what do you do? It's just like so many other things in healthcare. If you don't have coverage, do you really have care? So we've been working with Resolve for several years now. I live in Minnesota. That's where the majority of my work with the local coalition and with Resolve has happened. It's been fantastic. I see Aisha and Michelle on calls. We've had great collaboration and planning and strategizing. The fact that we've been working on this legislation for some time and not having passed it, I think says a lot more to the challenges in the local environment than it does the quality of the work that's been done. There have been a variety of circumstances along the way, but I think the resilience that we see from coalition partners like Resolve and the support that Resolve has provided on the ground locally for folks at the Minnesota Building Families Association and Coalition, it's been really important work. We've had work with volunteers where we've been able to bring stories to the Capitol. And a lot of them are blood cancer stories, but some of them are just people who care about seeing more fertility options available. Aisha, is if there's anything you'd like me to cover in the moment, I'm happy to talk about it. But the photo here is from our last lobby day. It's a state lawmaker, one of the coalition co-organizers, and a mom with her new baby, and yours truly.
Thank you, Dana. That was great. All right, next slide. I'd love to introduce Alana from Jewish Fertility Foundation.
Thank you. Thanks for having us. I'm the CEO and founder of Jewish Fertility Foundation. And like many of us in this space, infertility is personal to me. I started the organization 11 years ago. And one of the reasons we are focused in the Jewish community is like some other cultures, there's just this added layer that celebrates babies, the next generation, but doesn't always know how to hold space for those like me who were trying to get there. So, what do we do to try to resolve this? We offer three main areas: financial assistance for IVF, IUI, and frozen embryo transfers. We just started offering grants for surrogacy as well. We offer emotional support through support groups nationally, and a fertility buddies program. And then we do education. We're not an advocacy organization, but we want to make sure that we help people understand their options and their path to parenthood. And one thing I should note, while we are the Jewish Fertility Foundation, we work with all faiths, all backgrounds, all family structures. One of the reasons I really loved this topic is because after RV Wade and all of the changes and modifications, one of our offices that's located in Alabama, Birmingham, shut down. And literally overnights, not only were our joint clients reaching out to us, but the doctors were as well. Our attorneys that we work with were as well. And very quickly, we were able to partner with an organization on another national Jewish organization called NCJW, and they were able to send us money to be able to literally move two couples in an emergency situation who were mid-treatment cycle from Alabama to Atlanta. And very quickly, again, not an advocacy organization, but we were able to bring together hundreds of people in an Instagram live similar to this, um, alongside Juliana Goldman, a reporter, for real-time guidance. Nobody really knew what was going on, but we were bringing experts to the table. And then, like we were just told, our staff, today we're seeing our clients working to go to the State House with Fight for Alabama. And even one of our staff members' story ran in Vogue. That means we really made a difference. And we continue to write op-eds based in Atlanta in partnership with an abortion fund. People don't always associate infertility and abortion, but we try to explain how these fetal personhood laws threaten Jewish religious freedom. And we were in the Atlanta Journal-Constitution. I could talk a lot more, but I'll stop here and pass it along to the next.
Great, thank you. I'll pass it over to Liz from Men Having Babies.
Hi, my name's Lise Regula, Advocacy Associate at Men Having Babies, and we're in this space from a little bit different perspective. We're specifically working with couples and singles in the LGBTQ community, especially those that need a surrogate in order to build their family. We do financial assistance, educational programming, as well as advocacy to help benefit and push forward ethical surrogacy. We were actually one of the first organizations to put forward our baseline protocols or our standards for what we consider important factors when doing surrogacy, when considering surrogacy, and when debunking a lot of misconceptions about surrogacy. Um, on the education side, we have a over a decade worth of videos of webinars that we have done with professionals, legal, medical, mental health, etc., so that people can understand what the surrogacy process is like, as well as, again, over a decade of panels of people with lived experience, parents through surrogacy, surrogates themselves, egg donors, and a few of the webinars actually have kids who have been born via surrogacy as well. So you're getting lots of different perspectives. We also have, depending on the year, 6 to 7 different in-person conferences, 2 to 3 days each, across the US and Europe. There are surrogacy boot camps. Folks can come into Atlanta, Fort Lauderdale, New York, Chicago, Berlin, Brussels, or San Francisco and actually have their questions answered by professionals about what does this process entail? What should I be looking for? How do I do this? How do I respond when my parents ask inappropriate questions about my surrogate or insist that I'm exploiting someone by doing surrogacy? And kind of help folks understand the whole process and what it means to have ethical surrogacy practices. Financial assistance side, like other organizations like JFF, we have grants as well as zero and low interest loans to help make sure that those processes are accessible. And we've worked with Resolve to help on the advocacy side of actually getting better IVF coverage and specifically making sure that IVF mandates, when they are put forward at various states, include same-sex couples and those couples and individuals who need to have a little bit of additional assistance in order to have their family. So surrogacy and third-party coverage, in order for us to back a particular IVF mandate, has to be part of that IVF mandate. If an IVF mandate or IVF coverage is only covering people who are in a cis heteronormative relationship with the person who is going to carry their child or the person who is going to be the other gamete donor for their child, it doesn't do our community a lot of good. So we try to be careful about making sure that those IVF mandates work for our community. Thanks.
Great, thank you. Next up, PCOS Challenge, we have Will Patterson here.
Thank you to the Resolve team for the opportunity to be here and to share a little bit about the information. We've worked with Resolve for probably over a decade now, and we, as also just kind of announced that there was a recent name change announcement for PCOS or polycystic ovary syndrome. The new name is polyendocrine metabolic ovarian syndrome. So you may see the use of PCOS and PMOS or PMOS mentioned throughout. But a little bit about the organization. We are the U.S. National Polycystic Ovary Syndrome Association. We are the largest support and advocacy organization globally for people with the condition. For those who may not know much about PCOS or PMOS, it is one of the leading causes of infertility in women or people who are assigned female at birth. It affects about 10 to 15% worldwide, and 10% of those worldwide. We, as an organization, have six major program areas. We focus on health policy and legislative advocacy. We're developing the national health policy agenda for PCOS. We also have do research where we engage with the government agencies like the CDC, FDA on treatment development. And really, just over the last decade and a half, we've been focused on building infrastructure to be able to support things like advocacy, research, and also the advancement of health policy. We formed the Bipartisan Congressional PCOS Caucus in the U.S. Congress with the support of the late Congressman David Scott, which was a loss from Georgia. And he was really instrumental in helping us to get a platform in Congress. So in nearly I say 80 years before we started doing legislative advocacy, there were only five mentions of PCOS in the federal government, which were largely footnotes that said PCOS could cause diabetes. Since then, because of the support of organizations like Resolve, who've participated in our advocacy days and congressional briefings and things like that, we were able to garner bipartisan support from over 120 legislators. And just like some of the challenges now, we certainly have seen some of the more moderate Republicans come under pressure, and it's been harder to maintain bipartisan support. But one of the things that is, I would say, um, unique about PCOS from an advocacy perspective is that it is connected to so many other health conditions like cardiometabolic conditions, heart in terms of um, so PCOS is an insulin resistant syndrome. Insulin doesn't work as well in the bodies of people with PCOS. So what that does is it places them at greater risk for things like type 2 diabetes, cardiovascular disease, and stroke. And what that has allowed us to do is to build a bridge to have those conversations around things like fertility coverage for people who that this may have been a more challenging topic to own and support. PCOS has been that bridge for us to engage and build a lot of bipartisan support on these issues. But as I've also mentioned, been very intentional about building our infrastructure to be able to. So we have 60,000 members, but to be able to engage those members in legislative advocacy and research in any state and congressional district. So we were very, again, intentional about building capacity there and also being able to build diversity within our advocacy coalitions. So there were a lot of different voices that were represented, and those voices would have a platform to be able to advance both policy efforts federally and at the state level, and also to be able to advance other priorities of the community. So we also have a patient-powered patient registry where we focus on answering the research questions that patients care about, since sometimes there is a misalignment between the government research priorities, clinical research priorities, and those of patients. And it really has just been, challenging, but also rewarding to be able to connect with so many amazing organizations doing great work. And we were also just really proud of our relationship and partnership with Resolve over the years. And just again, really grateful to be here among so many great organizations.
Great. Thank you so much. All right, next slide. All right, Tiana Wolford was not able to join us, but she's one of the panelists from Sickle Cell Red. So Sickle Cell Red is an organization that's focused on advancing education, research policy across reproductive and maternal health, but they're also focusing on people with sickle cell. For those of you that don't know, sickle cell, some of the treatment might cause infertility. So of course, this type of organization is incredibly important in order to get people the ability to freeze their gametes or to be able to use IVF once they want to start to build their families. And something that we've seen with the sickle cell community is that there is significant research, knowledge, and care gaps, and it's continuing to impact this community. So some of the challenges that they've noticed is reproductive health, fertility, genetic testing, maternal care are often really overlooked in the sickle cell community specifically. So the good news is that individuals with sickle cell are living longer and they are planning to have families, but now that gap in terms of giving them the resources, the care, the treatment that they need, and for it to be covered is incredibly important in terms of what we're advocating for to be able to cover those individuals. So, as you've seen, there's a lot of different groups that need IVF, fertility preservation. I think that's the biggest thing about the family building community is that we're an incredibly diverse group of voices and people who need this care. And as you all know, the statistic is that 1 in 6 people have infertility. And so, however you're planning to build your family, it's incredibly important to be able to actually have that coverage. Otherwise, it's just an insurmountable financial barrier. But of course, if you, as you've seen, there are an incredible number of organizations apart from just Resolve. They're working incredibly hard to make sure that people, whether it's advocacy or whether it's support actually of individuals or families, for them to be able to go through their journey to feel supported and not isolated, but also to be able to get coverage. So with that being said, we can switch it over to the panel. I have a couple of questions and some extra ones if we have time, but I just really wanted to get insight from all of these panelists here today. So one big question that I think Alana has actually brought up, so I'll ask you first, but what we've seen changing in the past couple of years. You've brought up Alabama, but if you could just speak a little bit more to that.
Yeah, it was a crazy time. I mean, literally the night before two of our fertility clinics shut down, the doctors that we partner very closely with were reaching out to me and saying, "How can you help?" And all I could do is a few things. Really focus on, okay, well, who are the our joint patients? We're not doctors. We're also offering fertility grants and support, but like what can we literally do for those people who were mid-cycle pumping themselves up with hormones in order to retrieve their eggs? And we were looking at that moment at two couples. They actually happened to have insurance coverage because both couples were university employees, and luckily their treatment was covered. But we had to make a very quick decision to say, okay, this is an emergency. My friend, the former CEO of National Council of Jewish Women, picked up the phone. She had an abortion fund, and she was literally able to say, okay, how much do you need in order to help these people literally last minute get out of Alabama because their doctors literally were on lockdown. They were not able to perform any treatment. Nobody was able to get embryos out of the clinic. And we used abortion funding in order to set up shop with our doctors in Atlanta. And they're the lucky ones. They were able to retrieve their eggs, create embryos, but they had to stay here. It wasn't just about the medical process. It was about literally picking up and moving for that period of time where they had to do treatment. And I think a lot of states, especially the ones that we're in 11 communities, are looking very closely. Our clients, our grantees, our doctors, I've never seen attorneys so nervous because this is the worst thing that they could imagine actually coming to fruition. And now today we have to really be more proactive. And some of the ways that we're being more proactive are, again, partnering with organizations like yours. We have so many people that we work with, thousands of people that we're lucky enough to help, and they all have stories. And one of the things that we have easy access to today is sharing out those stories in various different ways so that when the New York Times does call us, we can say, all right, here's a story that might be very helpful for you. And then I would also just say that one of the things that we're doing more preventatively is working with other nonprofit organizations. A little bit of a change of topic, but you mentioned all the amazing work that you're doing to try and mandate insurance coverage in certain states. Like, kudos, serious kudos. Also, we know that there are gaps, right? So people are still going to need our services, even in California or Massachusetts. I see men having babies nodding their head. Yes, like we have to be able to offer funding even in states that are offering great insurance coverage because there are gaps. And so one of the things that we're doing right now is doing training with HR professionals of nonprofits because generally they're smaller or under 100 employees. And we want to offer them different options on how they can cover their employees with creative solutions for fertility treatment access.
Thank you, Alana. That was great. And I completely agree. I think one thing that we've seen for Resolve as well is that post-Dobbs, post-Alabama, before we were really focusing on proactive work. So we're trying to get coverage in states, and then we were also seeing a lot of defensive work that was coming up in terms of bills that sometimes legislators might not think will affect IVF or fertility preservation, but it does actually impact it. And those bills move very, very quickly. We've seen RRM come up, which, of course, we always tell people if it works for you, that's great. But there are certain people like cancer patients or those with sickle cell red that they do need sickle cell that do need IVF or they do need fertility preservation. And so RRM would not be enough for those types of family building issues. And so that's something that we've seen as well is just how quickly that's moving and the need for us to get advocates to testify in person and how quickly you have to act, like you said. That's one of the major things that we've seen change. Dana, I'm going to call on you. What have you seen change?
Well, there are a few things. I mean, I think for the better, we're seeing all the time more people willing to come forward and share their stories about what they've experienced. Thinking about the timeline of Resolve. In addition to being an advocate for blood cancer patients, I'm an IVF dad. And I started this journey about a little more than 25 years ago. The environment has changed and it continues to change, some of it in ways that are very positive for patients when it comes to being able to share where you're coming from and find others who can relate. Uh, we've also seen, I think, policymakers to some extent be more receptive to the idea of fertility care as health care, not as some special offshoot that isn't thought of in the way we think of other aspects of treatment. On the challenging side, you mentioned RRM, restorative reproductive medicine. It's being offered as a rhetorical alternative, I think, to the standard of care that we would expect to see. There are aspects of it that can provide actual treatment benefits, but the way I've seen RRM discussed in Capitol buildings, there's an implication that the standard practice of fertility care isn't attempting to address what lies behind a person's fertility challenges. And though I don't practice medicine, I can definitely point to the witnesses I've worked with who do practice medicine, who would be happy to tell you that their efforts to provide fertility care attempt to address as much as can be addressed within the practice of medicine. So we see this muddying of the waters with competing versions of what constitutes fertility care. We definitely encourage people to follow the science, follow the medicine, and you see groups like ASRM, whose logo is up on the slide here, follow that kind of guidance to tell us what type of care is going to deliver the best results for patients. and stick to that. Another thing that we're seeing is some real challenges in the healthcare insurance space. The federal government just announced its most recent final rules for the National Benefit and Payment Parameters, which basically guides how Affordable Care Act marketplace plans should be managed. There are going to be some big changes coming to what states have to do to fiscally support state defined mandates. And that would include when your state has passed a fertility coverage benefit, what does your state have to come up with on the bottom line to offset the differences in costs? So we're in this shifting health coverage landscape that makes it harder to go out and get a win in this space and know that the win sticks. So there's always going to be work to do. And I guess we're here to do it.
Great, thank you. Liz, would you like to add anything? Things you've seen changing?
Yeah, I think this is not necessarily what we've seen changing because of RRM or because of Dobbs directly, but we have seen over the past few years on a parallel track this shifting of the narrative of how people see surrogacy in particular. Um, within the broader LGBTQ community, there's been widespread attacks on our community and our ability to be in a relationship with the people that we care about and not um, suffer as much pushback as we have been getting recently. And in the case of the trans community in particular, pushback about how we can present in public and whether or not we can really exist in public. Um, so that's one pressure on our community. And this has been a little bit wild because we have been familiar with the misconceptions around surrogacy being fairly common in Europe. And some of those misconceptions, as well as other misconceptions, we do see coming and establishing in the US. The idea that surrogacy is, by definition, exploitation of someone with a uterus is something that we're have seen creep up a little bit more often here. And the idea that surrogacy is a backdoor to get around immigration issues is something that is new to the US front and new to the discourse relatively recently. We actually had Florida bill that addressed which countries folks could be from and do surrogacy in the US that passed and as a problem, like ongoing. And I don't say all of this to say that surrogacy is without its problems. We're humans. Humans can manage to make mistakes in all sorts of creative ways. Parenting really teaches you that. And our stance at men having babies is very much humans are going to do what we're going to do, and it's important to try and do that in ways that reduce harm to the best of our ability. And this is gonna sound a little bit odd considering the US healthcare system and everything else, but relatively speaking, the US and Canada to the north are two places where you can do surrogacy legally, safely, and in a way that protects your family with far less chance of exploitation than we have seen in other countries. So seeing those restrictions around surrogacy and those increased misconceptions around surrogacy established in the US and really the possibility of restricting surrogacy here further, that's not just a problem for people in the US. It is a problem for residents of those countries where people will go to do surrogacy instead, where they might not have the same, either the intended parents might not have the same legal protections for their newly created family, or the people carrying that child might not have the same protections and good healthcare system that we do have here. So really, this is, for me, it's a little bit of a scary time. The last thing I want to do is put more people at risk. Um, and I say that surrogacy can be done ethically and can be done in a way that is incredibly beautiful, in part because I've seen it happen. I didn't mention this in the intro because it's not part of the business itself. It's me. I've been a surrogate twice. I looked a little bit different there then, but both of those surrogacies were experiences that I would not trade for the world. And to know that other families might not have the possibility of having those experiences hurts.
Thank you. Yeah, that was powerful. Um, Will, what have you seen change? I know you brought up the name change that's recently happened, but if there's anything else.
Sure. Well, to some degree, it kind of feels like a tale of two cities where, there are, like Dana said, there's some amazing things that are happening, and then there are some challenges and some shifts that are happening. And that also changes how we think about how we engage and also the different policy levers that are available to us. So I'll kind of unpack that a little bit. With regard to the PCOS patient community, as I mentioned, it does affect a very large population, which historically had been absent from a lot of advocacy and policy. So to be able to empower this large group to now be able to engage in advocacy around things like fertility coverage and just broader access to care, that has been really encouraging to be able to equip this population to be able to do that. And you have more and more people willing to share their stories, whether it's through awareness campaigns. We've also been very fortunate to be able to partner with other coalitions and campaigns. Like we're part of the Black Infertility Awareness Week coalition that does events throughout the year to again reach different populations. That's really been important to us. As I did also mention at the federal level, we are seeing some increased pressure on legislators and um, which has forced again some of the more moderate to retire. We are also seeing that um, it's forced also just legislators to what I would say defend kind of some top line issues just around health, much less get into let's say women's health or issues a bit further downstream down into disease specific issues. And while they've been forced to work to defend harder those kind of top line, it's allowed us to think differently about how we engage legislatively and not just legislatively, but also looking at other policy levers that are there, because a lot of people may think that the only way to advance things is to get a bill passed. But there are other policy levers. There's also institutional advocacy that you can engage in. There is advocacy at the corporate level. So really empower, while we may be in a holding pattern in some respects at the federal level, we look at how do we build capacity just in terms of being able to do advocacy. How do we support other coalition partners in their frontline efforts? We also look at how do we bring more people into the coalition? How do we better train? And then how do we empower them to get in somewhere and start? So we think about the work that we do um, as a spectrum and also a continuum. meaning a spectrum you can get in, and whether it's tell your story or whether it's start an organization, there's a lot of space in there, but the point is find some place and start. So that's the spectrum part. And then the continuum part is once you start, keep going. And you will inevitably encounter some resistance, but don't view that. Sasha just wrote a great article for Voyage where she talked about. So also Sasha, if people don't know, she's the founder and executive director of PCOS Challenge. She also happens to be my wife, but she also wrote this great article where she was talking about don't view resistance as a sign to stop, view it as a sign to build. So when you meet that resistance, think about how do you build? How do you build capacity? How do you span a coalition? Um, and it's really hard in this space because we fight so hard, we build so hard, and then we hit a wall. And it feels devastating when we hit that wall, but that is just again a sign that we're to build. So there's some of the things that we have learned and are doing. And again, I'm just really fortunate to be in this work. And uh, the other thing is just, it's just a blessing to be around people who give, to be around people who want to empower, inspire, provide opportunity for others. That's something special. And a lot of times we may forget that, but particularly when the work gets hard. But this is something special, and it is important to take a step back and always remember that.
Thank you. That was amazing. Um, so next question is what's at stake? I think some of us have brought it up already. Dana brought up RRM, which is again restorative reproductive medicine. I know Resolve, we've done a webinar on it. We have information on our website about it. So I think when we're seeing RRM, for example, a law was passed in Arkansas and it passed very quickly. And so that means when we're looking at a state like Arkansas, it might just be more difficult to go in and say, yes, you already have this. And to lawmakers, they might say, well, why do you also now need this IVF law? Why do you now need this fertility preservation law when there's already a fertility law in place? And so I think that's some of the issues that we've seen, at Resolve at stake. And I also just think Liz touched on this a bit, but just the stories and the misinformation that comes out about family building and why people might need this coverage. We're seeing a lot of different types of stories that's not reflective of our actual community and their actual stories. So I think what's at stake is us really trying to get people to share their story. It's the most important thing that we always say when you're talking to legislators, but also that shift in thinking about also needing to talk to the media or social on social media or going to go testify, just different ways of sharing stories. So I think it's just that issue of the misinformation, especially for us, and also just RRM. But I'm very curious to see what's been at stake, for other groups. So Dana, I can start off with you.
I feel like we've kind of covered what's at stake. We're trying to make it so more people can have the families they want to have, despite really challenging medical circumstances, and we're trying to make it so that the income you have or the assets you have aren't the determining factor on whether this care is available. And I feel lucky for the circumstances at the time that we were able to liquidate assets back in the day to have kids, but that meant that there were a lot of people who weren't in that position, and I can only guess what they did, and it's sad. So what's at stake is continuing to bend toward more people being able to seek this care and get it without having to effectively bankrupt themselves or impoverish themselves. And in the meantime, continuing to educate the public and policymakers about what constitutes the best chances at making this advance. That's really it. And I know that we have a variety of folks around the table who come at this issue from different angles. So sure, there's a lot more to it.
Yeah. Alana, can you speak on this a little?
I mean, you said it. You said everything. I think that we really just try to simplify, take it down to the basics of sperm, egg, embryo. What happens when you state that this embryo is a life, and then how does it directly affect IVF? And gosh, I mean, where would we be in our family building journey if we didn't have IVF? And then really just the explanation. But you said it, and our services would we would not be able to be providing grants and financial assistance if there was, an issue with being able to do it.
Will?
Well, I think there's a lot at stake and there's a lot going on, both in terms of just major cultural shifts, major political shifts, and family and community and partnerships and relationships will be the thing that matter and that sustain, particularly as there is increased pressure on people, whether it's what AI will mean to family and relationships and children, whether it's um, a so we also work with state departments of public health to get questions added to their PRAMS questionnaires, their the pregnancy risk assessment, and the division at the CDC was pretty much laid off that did they coordinated the PRAMS work. So to be able to do surveillance and things like that, a lot of people don't think about the downstream impacts of a lot of these things that won't be felt for some years. So I think it's important, again, to build the capacity, to build the relationships, to sustain the champions that are doing the work. When they get tired, we step up and help and take on those parts. But I think, again, community support, being able to be there for our communities and to be there for each other will be increasingly important because I think we're at some inflection points at a lot of things around society. And hopefully it goes the way we want it to go. And I don't want to be a pessimist, but like there is a lot at stake. And fortunately, again, there are a lot of amazing people and organizations doing the work. And I'm an eternal optimist. I'm definitely one for internal locus of control. I believe that we always have the power to do something to improve something as opposed to there's nothing we can do. So I think that's at the end of the day, our futures, our families, our humanity, all of those things are at stake based on the work that we do.
Thank you. Liz?
I think the biggest thing that I see at stake right now is the progress that we've made within the past few decades. Um, Same-sex marriage was only legalized at the federal level because of Obergefell v. Hodges in 2015. Both of the pairs of intended dads that I cared for, those were prior to 2015. So those families were not families in the way that we would think about them under normal circumstances because they did not have that protection of marriage and all of the privileges that go along with it. And, on the medical side, what we have seen is when states ban certain procedures or when states make it harder to more stigmatized to go through certain procedures. We've seen this on abortion. There are fewer people that practice those procedures, and it becomes even harder to find professionals to do the things that we need. And as we're moving attention more towards RRM and away from IVF, when we were just finally getting to a point where IVF was really more acceptable and seen as a normal family building option, that shifting of attention, it could make training for procedures around IVF harder to access for the next generation of doctors as well.
Yeah, thank you. So I'm going to save this last question actually for the end, but I would like to ask all of the panelists in one sentence, what message do you want people to carry with them when they leave this webinar? Like, what's the one thing that you either want people to think about or something to reflect on or just anything to carry away? And I can start with Alana.
I think kudos for being here and continue to listen and to speak up because that is going to enable change.
Thank you. Dana?
I'd say bring friends and remember there are lots of ways to find common cause with the goals we all have at the table here.
Yes. Will?
Well, I will borrow from Sasha and I will say if you have not started, just find a place to start wherever that is, tell your story, or and if if I won't say if, but when you encounter resistance, don't view it as a sign to stop, view it as the sign to build and keep going.
I love that. Liz?
I would say that having kids is probably the most hopeful thing that anybody can do, whatever the path that takes. And what better way to build the future that we all want than to raise the families that we all want?
That's amazing. Thank you. All right, we have a couple of minutes left, so I would like to see if there's any questions, anyone in the audience. If you have anything you'd like to ask our panelists, you can use the raise your hand feature and we can call on you, or you can put it in the chat if you feel more comfortable and I can read it out loud. Any questions? Any questions for anyone? All right. Well, you can always put in the chat or you can contact us at Resolve and we can always answer those questions. Okay, Jackie said no question, but quick comment. This was really informative. Thank you for putting this together. Thank you for our panelists for just being here. It's the day after Memorial Day, so I know it can be a bit hard when you have the day off and then you're jumping right back into work, but thank you so much. See, Susan in the comments says, thank you to all the panelists for an open and honest discussion. And yes, I definitely agree. Thank you so much. All right, we can go into our closing remarks. So again, I just wanted to reiterate the shared goals that we've all discussed here, improving access to care for everyone, expanding and improving fertility coverage, keeping it legal, like Alana says, when we're talking about issues like that, we're looking at families up and moving completely just to be able to get continued access to care. And no one should have to move and completely uproot their lives. And also, just as Dana brought this up again about ASRM, just continuing to protect the best standard of care delivered by healthcare providers, and also just for the patients to be able to retain their rights over their reproductive health, which I think Liz has also brought up as well. So with that being said, I just wanted to say thank you so much for everyone that has joined our call to action. Again, if you're here, you're more than likely already participating in the month of action with the Resolve, partnering with ASRM. But if you have not, maybe you just saw this webinar somewhere, I'd encourage you to participate in the month of action activities. We have a couple of different options. I've also included a QR code. If you'd like to learn more about surrogacy, Men Having Babies has an amazing research library. That QR code right there at the bottom can take you right to that. So please take a screenshot and bookmark that page. And then we can go to the next slide. And Alana has a couple of ways to get involved with the Jewish Fertility Foundation.
Sure. And sorry if I wasn't supposed to add my own slide. I was trying to
No, no,
follow
no.
instructions. But yeah, we offer free infertility support groups in local communities as well as national, run by infertility therapists. It's open to anybody, regardless of religious background, and journey. And we can also offer free one-on-one fertility buddies, for somebody who is not your friend, not your therapist, going through this crazy journey. And we're also always looking and requesting people who are now on the other side. Become a local ambassador, follow us on social media, and of course, sign up for our newsletter.
Thank you. Dana and Will, do you have any calls to action for anyone? I know that you both have lobby days that you've done in the past before, but is there anything you'd like anyone on this call to do?
Well, to say, people can learn more about what we're doing. They can follow us online at PCOS Challenge, which you'll see in my kind of handle here, or they can visit us online at PCOS.org. We'll also be doing our annual symposium. This year, we're going to be partnering with the PCOS team at the Harvard Medical School to do our event on September 19th. So you're welcome to come out and learn more about advocacy and ways to get involved.
Yeah.
Say, feel free to find us at bloodcancerunited.org. If you'd like to get in touch with me, I'm at dana.bacon@bloodcancerunited.org.
Great. Thank you so much. Next slide. All right. Again, thank you so much to everyone that has joined us tonight to just learn a lot more about our partner organizations. They do incredible, incredible work for so many different communities. So it's just amazing that they even have the time to join us for this webinar, and I really appreciate it. And I also just want to finish off just saying thank you to ASRM. We're doing this month of action in alliance with them, and also to our sponsor, Organon. We would not be able to do the work that we do or to have webinars like this without their support. So again, thank you so much to everyone. If you have any questions, again, you can always email any of us or go on our website, sign up for our newsletters. But again, just keep in touch, share this information with people in your community. And yes, keep on advocating with us. Thank you so much and good night.
Thank you, everyone.